My name is Dylan Webb, and I'm going to be giving a speech about Alzheimer's. Alzheimer's is the most common form of dementia. According to the Alzheimer's Association, dementia is a general term for a decline in mental ability severe enough to interfere with daily life. In the article Alzheimer's Disease Causes, Symptoms, and Treatments by Marcus McGill, he writes, there are an estimated 5.3 million Americans of all ages with Alzheimer's disease, and every 67 seconds someone in the United States develops the disease. Alzheimer's is the deterioration or failure of cells in the brain. The failure of these cells affects people's abilities to remember recent things that have happened. Those that develop the disease typically begin to show signs around the age of 65. Many people think that it is a normal part of aging, which is why it has the nickname of Alzheimer's. However, it is not a normal part of aging. Not everyone is affected, but approximately 200,000 Americans under the age of 65 develop the disease. Alzheimer's is a disease that cannot be stopped, but there are treatments to help with the symptoms. There are two types of Alzheimer's disease, late onset and early onset. Late onset is the most common type of Alzheimer's and typically begin to appear around age 65. Early onset can start as early as age 30. Regardless of which type of Alzheimer's a person has, symptoms are the same. In the article Alzheimer's Disease, a Clinical and Basic Science Review, Dr. Igor Korolev writes, various cognitive abilities can be impaired with dementia, including memory, language, reasoning, decision-making, visual-spatial function, attention, and orientation. The most common sign is memory loss. They lose the ability to remember dates, events, and keep asking the same questions or repeating the same information over and over. However, sometimes they can remember things from their childhood. They will also forget where they are or how they got there. A second sign is difficulty doing familiar tasks such as driving or making coffee. A third and common sign is misplacing items. Many times they will put things in unusual places and cannot recall where they put them. Poor judgment or decision making is a fourth sign. People with Alzheimer's have been known to give away large amounts of money or items of value. A fifth sign is personality and mood changes. They become anxious, fearful, agitated, or depressed. In the late stages of Alzheimer's, people may forget how to chew or swallow food, which can lead to choking or excessive weight loss. Though there are many signs of Alzheimer's, there is no single way to check to see if someone has it. To diagnose it, a series of assessments is needed. First, the person's medical history is needed, including medications, previous illnesses, and medical conditions that family members may have or had. Next, a physical exam will be conducted regarding blood pressure, listening to heart and lungs, and blood tests. The third assessment is a neuro exam to test reflexes, muscle strength, eye coordination, and speech. A mental status test is the next step. This will evaluate the memory, ability to solve simple problems, and test thinking skills. The last assessment is a brain image. This does not diagnose Alzheimer's, but instead it is used to rule out other conditions that may be causing the symptoms. As of today, there is not a cure for Alzheimer's, but there are ways to treat the symptoms and improve the quality of life. The most common treatment is medication. There are several approved medications, though, that may or may not work. It all depends on the person. In addition to medications, exercise, healthy nutrition, and eating, and creating a safe and supportive living environment are other ways to help those with Alzheimer's.